do you use ozone at all in your practice?
I do.
Okay.
And you can use ozone in those types of things, but still it won't penetrate into the dental tube. It only goes a little ways, but the laser is showing that it can. The Biolase laser, it's a very expensive machine. So by the time you see the root canal, you might go, Jesus, root canal costs so much money. Well, he's doing Gentle Wave, which is a machine that costs $150,000, and the Biolase is $100,000. So you're $250,000 in just to try to disinfect a tooth. This is the attempt to save a tooth, because some people would rather live with a root canal than take it out and maybe be challenged with the dropping quality of eating and things like that. Because, you know, I've seen the devastation on the opposite side where you go to the extreme. All root canals need to be pulled, because there are some camps out there that believe that. And as a result, you have these people that become dentally compromised. They're losing all these teeth, and they don't want dental implants either. So they're chewing with something that's removable, and it starts ruining their other teeth. They start heading toward a denture, and the quality of their life drops. And some feel better physically and some don't. It's a roll of the dice. So I try to, in my practice, I stay more in the central area where I can see the science a little bit better.
I mean, a big part
that helps.
Oh yeah. And I think
confusing area.
A lot of what, you know, patients, especially who have dental issues, go through is this kind of immediate pushing to remove or to just do root canal. It's kind of like, you know, there's no middle ground. It's black or white. We see something a little bit there, let's take it out. Whereas I believe your approach would be, how do we save the tooth? And let's say someone comes into you with some cavitation, but it's early on. How would you go about, you know, dealing with that patient?
Well, if there's a cavitation, I mean, that's just some leftover potential infection down in a bone where a tooth was removed. I refer that. I have a couple of surgeons that'll remove that. They'll use a CT scan, they'll go in and remove it, but they're also using the patient's own blood supply and centrifuging. It's called PRP, injecting in the area. Some will do ozone, et cetera, but the PRP seems to disinfect the area even better, because you macroscopically, you can't grossly cut it all out. There's going to be remnants of that infection and bacteria and toxic sludge that's left behind. So you want to sort of clean it out chemically if you can, and then put some of the body's own natural ingredients in there, growth hormones and things like that, to help reseal and regrow that bone. But I'll tell you, with biomimetic dentistry, and it doesn't work all the time because some people come too late where the decay is really deep, but for example, when I was doing traditional dentistry, if I saw deep decay, we were taught this in school too, right? Well, it's going to probably need a root canal anyway. Might as well do it now. That was the theory. Now, because it's a gray area, let's see if we can save the tooth and let it heal on its own and keep it alive. So just by testing it against ice and some other parameters, you can see, is it viable? Does it have a chance to try to survive, even if there's deep decay? Because in biomimetic dentistry, we can leave some decay over the top of the nerve area. We don't have to go in and drill it all out and boom, if we banged into that beautiful nerve. We can leave some there. As long as the seal is perfect, there's no decay there, we seal it. The body has its chance to re-heal that and turn that into good inner tooth material, and then the nerve stays viable. So the best is prevention, but if you can't go that route, you need a root canal. I would suggest all those that are watching and that they look at, or basically that they look for a dentist that's doing Gentle Wave and a Biolase laser.
That's good to know.